In 5, 4, 3, 2, 1.
Are we live?
We are now live.
Okay, so good evening, everybody. Welcome to this program with Orthopedic Research and Education Foundation, brought to you by Ortho TV. Today, we have the pleasure of having Dr. D.K Taneja from Indore. I think Dr. Taneja needs no introduction. He's been the past president of the Indian Orthopaedic Association and also the president of the SAARC countries, as well as has been involved in various teaching programs all over the country and abroad. And we have him talking to us today about the history of orthopedics. And I can't think of a better person to enlighten us on that, because he's worked with the giants of orthopedics, both in the UK and in India. And it'll be a pleasure to hear from him about how orthopedics has progressed over the years. So over to you, Professor Taneja.
Thank you, John, and thank you, Janki, very much for asking me to talk on a subject which is very dear to me. You see, all our orthopedic surgeons and our postgraduates should know that how the science of orthopedics evolved in the world. And therefore, my lecture will be in two parts. One, that how orthopedics evolved, and then how the Indian Orthopaedic Association came into existence, who are the people who played the crucial role. So therefore, the topic of my first lecture is the orthopedics evolved, then how it was resolved and was adopted by most of the people all over the world, and then how the lot of changes and the concept changed, and what we learned is now different what we do now. With these words, we will be taking you to the journey of the orthopedics, and I will relook into the science of orthopedics in different eras. As you can see that primitive era in ancient Egypt, in our Sanskrit area, Greece, Roman era, Renaissance period, modern period, and in the future of orthopedics. Now, this is a very famous Nicola Andri tree, which we all know. That is how it evolved in 18th century. And if we go into the primitive area, and when the lot of research was going on and excavation was going on all over the world, and then they found these types of bones. And these bones had fractures. And at that time, when it was a Stone Age or even a Bronze Age, nobody knew anything about the anatomy, or anybody knew how to treat these fractures. And one thing was that since nobody knew anything, so very famous thing was do no harm and do a masterly inactivity. So they just kept lying wherever there was fracture was there. As a result of this thing, that most of the fractures united, because there was no interference with the whole fracture hematoma or anything. But of course, many of the fracture must have united into a malunion. This is one of the things which was got in the excavation, which shows a perimeter in the skull, and there is a new bone formation. Therefore, it has become very smooth, which indicate that probably a skull holing was done, and that the patient might have survived. This is one of the indication of that surgery. When we go to the ancient Egypt, you all know that the Egypt civilization is one of the oldest civilization. Okay, so when we go into this thing, the very famous thing which we all talk about is the papyrus. And papyrus means the something which has been written onto some type of a paper which they used to make it from the bark or anything. And this some book was there, and this book was found in a tomb. And in 1862, it was stolen from there and was sold to one American called as Edwin Smith. Edwin Smith didn't know what this book was, and he threw this book over his one of the almirah, and it was lying there for quite some time, till that time when his daughter found that book, and she found that there is something very important and precious in this thing, and it is his daughter who got this book published, and that is what it is called as the Edwin Smith Papyrus. It is considered to be the first textbook of surgery. Uh, if we go into the Vedas, which is about 5,000 to 6,000 years back, and in these Vedas, also there is a lot of mention about the patient care. So, what were the important things in these Vedas? We found that they all said first, listen to the patient. Second, use your hand and eyes to examine. Third, make a provisional diagnosis and then decide, take a decision whether you want to treat this patient or you want to be contented or do not want to treat this patient. And this is what has been taught to us by my teacher, and this is what we are teaching to our students even today. The fractures can be treated by traction. It was written in Edwin Smith Papyrus. It can be by traction and bandaging. You can imagine that this is, I'm talking of 1600 BC. So that is almost 4,000 years back. So splints were found on the mummies made of bamboos, wood, and bark, which were padded with the linen, and this is what they used to do it if there was a fracture. And use of crutches have been found on the carving of 2830 BC on the entrance of the Portal of Hirokoki tomb in 2830. So they found that people even were using crutches to ambulate themselves, especially patients who had a paralyzed limb because of polio. In about 2400 BC, the 5th dynasty of Egypt, the first record of splints and the first successful amputation was done. It has also been recorded in that book. So the treatment of a dislocated jaw by thumb pressure method has been recorded. The fractured clavicle, they said put a block between the two shoulder blades, and this is what we do when we are putting a figure of 8 bandage. Cervical spine dislocation with transection of the card not to be treated, very clearly written in that book. And the signs of torticollis and discharge from the bone has also been mentioned, which they call it as a rit, or which is a pus as we call these days, and probably the osteomyelitis. Now, all these things are mentioned in that book. Infected compound fracture, which were considered to be very grave injury, and dressing by the fresh meat as it has the hemostatic properties. Therefore, they used to do the dressing with that. Alexandrian School of Medicine in the 3rd century BC, and they talked about that if you have a fracture dislocation, the most important thing is first reduce the dislocation and then tackle the fracture. This is what we do it as on today also. This is a very interesting thing. You see, there lots of team from Western world has been coming to Egypt, going and digging out the mummies, dissecting them and studying them. And the secret of User Montu is a very famous thing. If you go, it is written in many ways. Thing. And this gentleman, Wilford Grigg, who was from Brigham Young University, and he found when he x-rayed the whole mummy, he found that a metallic rod inside the through and through the knee joint. Probably that this their king or whosoever was might have been suffering from a very painful knee joint, severe osteoarthritis, and they try to restrict the movements of the joint so that the patient will be pain-free. So we have given this was 630 BC, and we have been giving this credit to Kunsher, that he was the man who popularized the intramedullary nailing, whereas this thing has already been done as before as 630 BC. The Egyptian also knew how to reduce the shoulder dislocation. You can see this thing. And later on in the modern era, the same method came to be known as the Cocker's method. This is the logo of the Egyptian Orthopaedic Association. I have looked into the logo of almost all the countries, their orthopedic association, and all the countries have a Nicola Andre's tree in their logo. This is the only association in the world which does not have the logo of Nicola Andre, and they have shown their method of reducing a dislocation of the shoulder joint. Shushruta era, which was about 600 BC, and in Shushruta Samhita, I have seen this book myself and little bit read also. And he said that if the flexure united without gap, shortening, angulation, and patient had a painless early movement, this exists, then the bone has united very nicely. This is what is the Shushruta mentioned in his Shushruta Samhita. And the orthopedic at that time was called as na Bhagna Chikitsa. This is very interesting. The Shushruta Samhita has 184 chapters, 1,120 illness, and the 70 medicinal plants, 64 preparation from the minerals, and 67 preparation from the animal. The Shushruta Samhita from the Sanskrit has been translated into English by one Ayurvedic professor from Banaras University, Professor Singhal. So I read that his book, very interesting, from where I got all this information. So this is Shushruta at that time knew how to make incisions, very interesting, how to probe, how to remove a foreign body, what is a thermal cauterization, which we are talking these days, and the 6 types of different dislocation, 12 types of fracture, which we talk about this thing. He classified the bones, and he talked about the reaction to the injury, and talked about the surgical instruments. You can see this is a diagram from the Shushruta Samhita, all the instruments. And many of the instruments these days are almost a copy what Shushruta Samhita had in his book. This book, Shushruta Samhita, was translated into Arabic by Boone in 8th century and was translated into English by Kaviraj Kunjalal in 1916. You can see that this is from the front page of that book by the Kaviraj. This was done. And 4 principles of treatment fracture in the Shushruta Samhita has been given very clearly. What he talked about, Anchana, that means you give a traction. Then he talked about Vedana, means you must manipulate it. And then he talked about Shepna, means opposition and stabilization. He talked about Bandhu, means you must immobilize it with any type of a spling. And Asthi Purna, that if you want to do some type of a bone grafting, and Chakra Yoga, where you want to give a skeletal traction. So the vast medical literature of the ancient Indian practically remains as yet to be unexplored. And there is a reason for this, that why our Indian medicine did not become popular, and there is a very clear reason. In ancient Greece, that is about 500 to 336 BC, there were many important periods. You can see this thing from Neolithic period to the classical period as we come nearer to this thing. So there are many, in the Greek period, there are many renowned people, philosophers and poets and physicians, and this was the famous temple of Amenhotep. I had been to Greece and I've seen all these things, and out of those important people in the Greece, the Hippocrates was very important in the field of medicine, about which we all take a Hippocratic oath. So this is the Hippocratic Oath's original book. You see, when my son was studying in Yale University, so I would go to the Yale University School of Medicine, their library, and I was surprised that they all have the copies of these original books, and that very much interested me. And from there, I took these photographs. So they also talked about the Hippocrates, that you must reduce by traction and then bandaging. Do an oil application before you do bandaging. And then Hippocratic method of reduction of shoulder dislocation, we all are still following it. And he talked about that the fracture will unite in 40 days. He talked about the varus deformity, which is very common when you're treating a fracture humerus conservatively, and he talked about how the method to prevent it. In the same book, there are lots of method of stabilizing the fracture from externally, and what we call them these days external fixators. And this is from the book of the Hippocratic, that how they have devised the external fixators themselves. Then there was a Paul of Agenia, his book Epitome of the Medical this thing, patient should lie till the callus is formed. He believed that a complete rest is required for the patient to this thing. And he did talk about the complication of tight bandaging, which we all know that even a tight plaster, any tight bandage can give you a lot of problem. The ancient Greek used a traction, and this method died till the Middle Ages, but was revived by a French surgeon called as Guy de Chauliac in 1300 and 1368, who again talked about the use of the traction in treatment of the fractures. The Roman area, which was from 27 BC to 476 AD, the Celsus was a very famous physician at that time. His book on the medical writing, the De Medicina, his philosophy was accepted till late 19th century. Book written in Latin described different types of fracture and signs of fracture. Importance of early reduction and bandaging on 7th or 8th day to reduce the swelling, falling. And this is what we are teaching today also, that just don't apply any cast or anything in the first 6-7 days till the edema and the tissue reaction and the injury reaction is reduced. This is what they had also talked, written in their book as. Now, this Galen was another very famous surgeon, and Antelius was another surgeon in the Roman time. And you all might have seen this beautiful picture, Gladiator, and this is a photograph from that picture, Gladiator. And the gladiator used to be the warriors, and they will go in the Colosseum and will have play the game, fight with each other. And Galen was the surgeon to the gladiator. Galen described about the spinal cord and the cranial nerve, and his work got burned in a great fire of Alexandria Library. You see, Alexandria Library was one of the very rich library with the thousands of books, and it got burned there. And he talked about the fractures, dislocation, and wound. He was physician to the gladiators, and he said, reduce the fracture, but apply bandage and splint only on 7th day. There's a good mention about in these books about the artificial limbs, wooden legs, and iron hands. And you can see these photographs has been taken from these books. The Middle Ages was the time when the people were, they were fighting and fighting because there were no countries, the land was there, and everybody wanted to grab the land and to take the advantage of different minerals and everything. So there were lots of people having these sharp injuries by the arrows and by these things. And teaching and techniques what Galen gave were followed till Middle Ages. Then after the Middle Ages came the Renaissance period. Now this Renaissance period, as you all know, is called in the world is the most important period in the world, which is called the Awakening period, where you had Michelangelo, Leonardo da Vinci, and they all big name appeared during this period. And Michelangelo, the famous statue of David, and in 1510 to 1590 was the era of Ambroise Paré, who is also has been named at times the father of the surgery, who talked about the different knotting, different types of sutures. And the book written by him talks about the human anatomy, human physiology, surgery, also talks about the orthopedic surgery, and there's a mention of different artificial limbs and even the splints for the clubfoot and scoliosis corset. a book by the Peter Lowe in 1597, The Whole Art of Surgery. He discusses the art of surgery in a very well manner. And for the first time, he used the word amputation. Prior to this, the physician used to tell the barbers, okay, do and chop off this limb or do the cutting of this great toe or whatever it may be. It was Peter Lowe in 1597 who used the word for the first time, amputation. The Benjamin Gooch described different types of functional cast bracing, about which we give a lot of credit to the Sarmiento. It was his idea that you give this type of a brace, put the fracture there, and make the person walk as early as possible. And way back in 1972, when I didn't know anything about the functional bracing, I used to also make this type of local braces and used to treat these fractures very well. And then later on, I learned about the work of Sarmiento and took cast bracing as one of my very favorite subjects. The 1714 to 1708 was the era of Percival Pott. And you all know that Percival Pott is a very famous British surgeon. He is given the credit for starting the first aid. You know that when he fell down, how he got a door from a nearby house and made it into a stretcher and got himself shifted to the hospital. He talked about the fractures around the ankle joint and Pott's paraplegia, for which he very well all know. That is the John Hunter era was very important because though he talked about many things, loose bodies in joints, pseudoarthrosis, and fracture healing. In the name of John Hunter, there is a beautiful museum in the Royal College of Surgeons of England, and everything is so beautifully preserved there. And I think anybody of you who get a chance to go to London must visit this museum. It is worth spending the time there. I would say that he put the practice of surgery on a scientific foundation and laid the framework for the 20th century development. He taught lots of things very more scientifically, put it in writing into the books, and then on from the making this as a basis, the other surgeon took up and brought the science of surgery and medicine to this level as in today. A very interesting thing which I found that since 1780, a doctor called as Jean-Andre Venel, he was from the Switzerland, and he established the first orthopedic clinic in Switzerland in a place called as Orbi, which is away from Geneva. And this is given the credit of the first orthopedic institute of the world as Orbi Venel. Now, you come to get this thing when you go and search the book and literature, then you get this very interesting information. The early modern period again saw lots of war, and from 12th century onward, the awakening started, as we said, and up to 16th century, all the developments were under the shadow of Hippocrates. What Hippocrates had said, a lot of people believed that, and a lot of the medicine developed on the philosophy of Hippocrates. So this is how then the Nicola Andri and they all came and talked about the orthopedics in a more scientific way. And modern period started from 1800. Now, in 1800, the 19th century, very important things started developing. And one of the very important breakthrough was by Antonius Matheson, who was a Dutch army surgeon in 1852, who gave us the idea of using plaster of Paris for the immobilization of fractures. Of course, we know that now we have a fiberglass bandages, and we all know about the Lucas-Champigny. The Lucas-Champigny and the Huon-Thomas were contemporaries. Lucas-Champigny was in France and Huon-Thomas was in England. Lucas-Champigny talked about an early ambulation, early weight bearing, and knee in extension to be for the walking purposes. And this was just opposite the thoughts of a Huon Thomas, who always talked about enforced, uninterrupted, prolonged rest for treatment, treating the orthopedic condition, may it be infection or may it be a fracture. This was his philosophy of Huon Thomas. The Thomas Plint, you all know that how popular it is and how it was saved many patients in the wartime for undergoing amputation. And during the 19th century, some important books started coming. You can see that diseases of the hip, knee, and ankle, principles of the treatment of diseased joint, principle of the treatment of dislocation, deformity, and diseases of lower extremities. And this was the famous man in 1856 from United Kingdom who introduced steel screws, and in 1950 used the steel plates. So this is how the metal started coming at the beginning of the 20th century. And Joseph Lister, you all know that his work of the antiseptic surgery, the use of the carbolic acid, and these four people made a real difference in understanding the orthopedics in the present era. Robert Jones, who was nephew of Huon Thomas, who in fact wrote a lot of articles, which was the work of Huon Thomas. Huon Thomas never wrote any article. And George Perkin, George Perkin was working in St. Thomas Hospital, and he wrote a very beautiful book on the conservative treatment of fracture. And this book is with me. And who gave me this book? Dr. Mukhopadhaya Sahab gave me this book. Dr. Mukhopadhaya had that book, and he said, you must read this book and see how beautifully the principle of treatment of conservative fracture has been given in this print. Of course, in the modern area, the Watson Jones can be given the credit for bringing out the two beautiful volumes of that book. And later on, it was the edition was taken out by Ginger Wilson, who edited that book. And of course, the John Chanley, who was himself an engineer, who put a lot of engineering ideas into the science of orthopedics and made it look more scientific. World War II taught us many things, we all know that. And therefore, when we relook into the whole science of orthopedics, how we evolved, and you see it's interesting that the people knew the principle of conservative treatment of fracture dislocation. External fixator and cast bracing was also known. Metal and intramural nailing was being done. Treatment of congenital and other deformities like clubfoot, people knew it. There was an emphasis on the preventive orthopedics. Injury reaction was known. Basic surgical instruments were developed. Thermal cautery was in use. Orthotic and prosthetic science was also known, but primitive. But there was not much knowledge of the diseases of the bone. The reason being that in the earlier period, the longevity of the human race was hardly 25, 30 years. And most of the people died during the war period. And very few people survived for a very distinct. Therefore, you see in Indian, this thing also, if you have lived up to 60 years, it used to consider a very big thing, and it used to call it Shashti Purti, and big Havan and big puja would be done. But of course, now everybody is crossing 75 easily. Therefore, anyone who states that he has developed a technique that no one has thought of before, the chances are that it has been thought in the past already. Surgical ideas were much ahead of technique and essential for their success. In 1775, fracture humerus was wired, but infection killed the patient. In 1850, hip fracture was nailed by Langenbeck, but it failed due to the metal corrosion. Then the evolution of the science of orthopedics depended on the development of other sciences. Let us see how. In mid-19th century, the development in the chemistry that gave us the better anesthesia and better antiseptic. The development in the field of physics gave us radiology, X-ray, MRI, and CT scan. The understanding of biomechanics gave us the idea of a joint replacement. This development in the science of metals gave us the idea that how implant and other bone cement, etc., can be used. Then optics were developed, and that gave us the idea of doing an arthroscopy. And then in 1992 to 2005, there is a development in the internet and in the computer science, and that has given us that how the robotic surgery, computer navigation, etc., online conferences can be done. So this is what we learned, the basic principle of treating this thing, but gradually this whole idea changed, and there are more and more people talking about the open reduction, internal fixation, etc., and forgot about the basic principles of treating this thing. So in my thinking, what is the future of the orthopedics in this thing? My thinking is that most of the surgeries will be now day surgery, and you know that it is already being practiced. Minimum invasive surgery, yes, navigation, robotic, bone substitute, biodegradable implants, tissue transplants, advances in imaging, advances in rehabilitation program, pain management, metal-free orthopedic, sensor-equipped titanium implants, and orthosensor, a biological way to treat the arthritis. Now, these are the thing of our future, and already things that I've talked to you, many of these things are being already in use now. So what we learned from our ancestors, that how the science of orthopedics evolved, then how it got resolved and revolved, and how it got dissolved, and now what the orthopedic practice is going to be. That day is not far off when a resident will ask a senior consultant, sir, what is this bandage I found in the Almira today? So he will have to explain that this is the plaster of Paris. So this is how we have evolved. Now you can see that if you look into the evolution of the human being, and you see the whole thing is evolving. We are on one side, we are going to the Mars, and on other side, you see that how people have again come back, sitting on and stuck to the computer. So therefore, Sir Arthur Wing Penrose, in a clinical orthopedics book he beautifully wrote, that I believe the future is only the past again entered through another gate. So already many things have happened, which you people have not read and you're not seen, and you are putting it in your own language and your own way and bringing it. So from a very crude planes and crude artificial limbs and iron hand, we have now come to a very sophisticated practice of orthopedic, that is navigation and robotic orthopedic surgery. So there's a precision. You can do a total knee with the robotic surgery. You can do a total hip with the robotic surgery. You can do the spine surgery. And this is how our science of orthopedics has evolved, have resolved, and then dissolved. So this is how the science of orthopedics has developed. Thank you. Now I will take you to has developed in India and how we have formed the Indian Orthopedic Station and where we are today.
Okay, sir. Thank you, sir. Thank you so much for that. I think we
just
have...
go to the Janki. I'm going to just my other part of the lecture. Okay, I'm just finding out. How do you go to?
Open it in your laptop and then go back to share.
What do I do, John?
Just open the lecture in your laptop.
Okay, that's what I'm trying to go to my. How do I remove this page from here?
So just you can close that earlier one.
Yeah.
Close the earlier talk.
Yeah, I got it. Okay, right. Shall I go ahead with John with this? Okay.
Yes. How long is
Now we will.
Excuse me, sir. We are not able to see your screen, sir. Actually, I think you should minimize this one, and after that, if you open your PPT, then share it.
It is on the screen. Is it okay
It's not
now?
showing here. No, not so. You have to stop sharing and then open it in your own laptop before.
Okay. Stop share.
Now
And
open the talk in your laptop.
Okay. इसको हटाना पड़ेगा पहले.
हाँ, उसको डिलीट कर दे, बंद कर दीजिए.
हाँ, इसको मैं बंद कर रहा हूँ, बंद नहीं हो रहा है. हाँ.
So should we take some questions in the meanwhile?
Yes, take.
So if any postgraduate have any question, you can ask us directly, or in between, sir. The next talk also includes the origin of Indian Orthopaedic Association, sir. Otherwise, that next talk also includes the origin of Indian Orthopaedic Association, sir, in that.
हाँ, तो अभी मैं लेक्चर उसी के ऊपर बैठे में.
Okay, sir.
पूरा कैसे डेवलप.
Internet is not coming. Sound is not coming very clearly.
Should I? अच्छा, पर internet वाला है. Just call my son. He will help me. Just wait a minute.
Meanwhile, if you can enlighten us about the how our organization, Orthopedic Research and Education Foundation.
Yeah, I can do that. Devesh, can you come urgently and help me out? You see, the orthopedics in India, actually, the records say that it was in 1930s when something about the orthopedics was coming up and people were talking about the orthopedics, about the fracture treatment and this thing. Devesh, can you help me? I've got a lecture here on the screen के ऊपर.
So you just have to screen share.
Janki, is it visible now? Hello?
No, not yet. No, sir.
Not yet, sir.
Not yet. Okay. दिखाई दे रहा उनको.
अब आ रहा है.
That's right. Okay. So we'll start with the orthopedics in India and Indian Orthopaedic Association from the beginning to 2021. Devesh, the beginning of the orthopedics. as I was telling you that in 1919, when we look back into all the articles, the first article on orthopedic subject was by Dr. K.N. Goyal, who wrote an article on the trench foot leading to gangrene and published in British Medical Journal. That was way back in 1919. In 1927, the first orthopedic OPD was started and a clinic at a general hospital, Madras. And the first MCH orthopedics from Liverpool was Dr. M.G. Kinney, who worked at the General Hospital, Madras. From 1931 to 1948, Professor Narasimhan Iyer was, I think, the uncle of Dr. Balu Shankar, was looking after the orthopedic section of the General Hospital, Madras. And it was Dr. Katrak, because of his efforts, because he also did his MCH from Liverpool, the orthopedics in Mumbai developed. He is credited for establishing the first pediatric orthopedic hospital in India, which is a Wadia hospital. We all know that. The credit goes to Dr. R.J. Katrak. In 1938, Association of Surgeons of India was formed. Dr. Kinney was the first orthopedic surgeon to be the president of the Association of Surgeons of India. Later on, many orthopedic surgeons like Dr. B.N. Sinha, Dr. Mukhopadhaya, Dr. Dholakia, the 3-4 orthopedic surgeons also became the president of the Association of Surgeons of India. Dr. Swami, who worked at the General Hospital, Madras, was the first professor of orthopedics in our country way back in 1948. In 1952, an idea was conceived of forming an orthopedic association in Association of Surgeons of India and in a meeting held in Vellore. Now, this is a very interesting thing because this is a breakthrough. What happened, late Dr. B. Mukhopadhaya, who was having training in this thing and finishing his FRCS and MCI, came back to India, and he was very much influenced by the role played by Robert Jones, because the Robert Jones in Great Britain made a lot of efforts in separating the orthopedics from the general surgeons in Great Britain. And that had an influence on Dr. Mukhopadhaya. And Dr. Mukhopadhaya said that we should also separate ourselves from the Association of Surgeons of India. So this idea came to him, and he wrote one letter. And he signed that letter and sent it to Dr. Karam Singh Grewal, his contemporary in Amritsar, a very famous orthopedic surgeon. So both of them signed that letter, and that letter was circulated to all the orthopedic surgeons at that time in India, maybe 20 or 25, I do not know, that we should have a separate association for ourselves. So in a meeting held at Delhi, also which was attended by Robert Rowe. My students, Robert Rowe has been one of the great orthopedic surgeons in Liverpool and was contemporary of Professor Mukhopadhaya. And it was decided that we must at least have a section of orthopedics in India to start with. So in Hyderabad, Dr. B. Mukhopadhaya passed a resolution for this purpose. And there were 15 orthopedic surgeons who signed that resolution. And this is that page on which it was signed. You can see Dr. M. Rajan, Dr. K.S. Grewal, Dr. Narasimhan, Dr. A.K. Gupta, Dr. D. Rangareddy, Dr. P.A. Menon, James Donaldson, Dr. K.S. Bore, Annamalai, and Dr. A.K. Saha, Dr. M.T. Mehta is there also. M.T. Mehta was at that time, in 1954, was doing MS orthopedics under Dr. Mukhopadhaya. And from Patna, he went to Hyderabad. He became also one of the signatories. Dr. Mukhopadhaya name is there, and Dr. B.N. Sinha name is there. So these were the 15 people, you can call them, as the founder of the Indian Orthopaedic Association. And interestingly, Dr. Hoffman, who was from America, had come to attend this meeting also attended this group, but of course, since he was not an Indian, he did not sign on to that. So there they formed the first executive committee. And interestingly, Dr. P.N. Sinha became the first president, Dr. Katrak and Dr. Swami became the two vice president, and Professor Mukhopadhaya became the first secretary. So the first meeting of orthopedic surgeons at Ludhiana, which was also attended by Professor Harris from Toronto, and then in 1954, the first two orthopedic surgeons were trained in India, Dr. B.B. Joshi at Mumbai and Dr. C.P. Tiwari at Lucknow. B.B. Joshi got trained under Dr. Katrak, and Dr. C.P. Tiwari got trained, and they both got MS Orthopedics. The MS Orthopedics were opened in Bombay and Lucknow at the same time. So they both got the two surgeons who got the MS Orthopedic, two first orthopedic surgeons of this country. In 1956, the first official meeting was held at Calcutta, and Dr. Sarvadhikari was the first organizing secretary. And in 1957, decision was to hold two meetings, one summer meeting and other with the Association of Surgeons of India. That is how for quite some time we were having one meeting of the purely orthopedic surgeon in the month of August, and other used to be held in the month of December with the ASI people. In 1958, to honor Dr. Gopala Kinney, the Kinney Memorial Oration was started by the orthopedic surgeon, and it was decided that it is the immediate past president will deliver this lecture. However, the first lecture was delivered by Sir Harry Platt, because most of the orthopedic surgeons of that time were the students of Sir Harry Platt. He was invited, and at Visakhapatnam, he gave the first Kinney Memorial Oration. In 1960, with the help of Dr. A.K. Talwarkar, two fellowships in Indian orthopedics started. One was Johnson & Johnson Fellowship, which was for the touring the different centers in India, and Smith & Nephew Fellowship for two surgeons to go abroad to update their knowledge. The first brochure, which was precursor of the Indian Journal of Orthopaedics, was printed and contained articles by Professor McFarlane, Robert Rowe, Howard Rusk, Durrai Swami, Mullah Firoz. And in 1963, the first Smith & Nephew Fellows were Dr. A.K. Gupta, and I'm very proud to say that I'm a student of Dr. A.K. Gupta and Dr. K.S. Bose from Calcutta. And the first Johnson & Johnson Fellow were Dr. Chobal, Dr. A.K. Das, Dr. M.T. Mehta, and Dr. Satyanand of Kanpur. In 1966, the Constitution of Indian Orthopaedic Association was finally adopted at Manipal. Section formally became Indian Orthopaedic Association in 1966, but continued to be working with the Association of Surgeons of India. In 1967, a Department of Orthopedics at All India Institute of Medical Sciences became the permanent office of the association. And from a brochure from 1967, the Indian Journal of Orthopaedics was started, and the editors were Dr. Chandra and Dr. B. Mukhopadhaya. In 1968, Dr. K.T. Dholakia was the president of Indian Orthopaedic Association. Now, this year is very dear to me that during his presidency, when meeting was held at Indore, and I was doing my post-graduation, and my professor sent me that I should go to Indore and read my paper of my thesis. So for the first time, I had a touch and feel of the Indian Orthopaedic Association at Indore meeting in 1968, and where I read my first paper, K.T. Dholakia was chairing that session. So the British Orthopaedic Association celebrated its golden jubilee in 1968, and they invited the president of Indian Orthopaedic Association, Professor K.T. Dholakia, at Nottingham, and gave them this jewel of office, which is this thing, which is worn even today by our president. The Constitution in 1980, from 1968 to 1986, it almost went on routine, but the Constitution was revised, And the orthopedic section of the Association of Surgeons of India finally got separated, and we stopped going and holding meeting with the ASI from 1986. And the Indian Orthopaedic Association was born as an independent body. This is a very landmark year in the, you see, for postgraduates to know that when did the independent exist as independent? 1986. When was the first resolution was formed? In 1954. These are some landmark which you must know. So the first generation of the pure orthopedic surgeon in our country were M.G. Kinney, Gopala Kinney, Dr. Katrat, Dr. G.C. Sen of Asansol, and Dr. S.R. Chaudhary of Kolkata. The second generation who made a significant contribution in the development of orthopedics in my country, Dr. Mukhopadhaya, Dr. A.K. Talwarkar, Dr. Bose, Dr. Merchant, Mullah Firoz, M.B. Sant, Karam Singh Grewal, A.K. Gupta, N.T. Agarwal, M.L. Chatterjee, A.K. Shah, K.T. Dholakia. This is the second generation. And then most of us, like me, we are the third generation of orthopedic surgeon. And now, of course, we have the fifth and the sixth generation going on in our country of the orthopedic surgeon. So at present now we have almost 23 chapters, and Professor A.K. Gupta's to honor him, the Indian Orthopaedic Association started to have the best chapter trophy in the name of Dr. A.K. Gupta trophy, which is awarded every year to the best chapter of the Indian Orthopaedic Association. Many of my postgraduate students whom I tell them that you must become a member of IOA, they ask me what are the activities of IOA. The IOA is doing a lot of activities. We are doing a state-of-art annual conferences. You all know that now about 6,000 orthopedic surgeons attend that meeting with a lot of foreign faculty. We are holding instructional course lectures. We are having a PG instructional course lecture. We are holding workshops through different state chapters and a subspecialty association. We have every year we hold a very nice K.T. Dholakia CME program, visiting professorship, National Initiative for Trauma Awareness Project, grant in aid for research projects, inland and foreign fellowships. And you can see that we have lots of fellowship, both inland and foreign, like Johnson & Johnson, Robert Rowe, Babulkar, Kulkarni, IOA, WOC, SICOT, Smith & Nephew, Japanese, and AO and Indore, and many other fellowship which we have this thing, and lots of our young orthopedic surgeons are availing these fellowships. We are also having lots of gold medal, like A. Mehta gold medal, Dholakia gold medal, Bakshi gold medal, Ralan gold medal, K.P. Srivastava gold medal, P.T. Rao gold medal, S.S. Yadav, S.P. Mandal, and Joy Patankar gold medal. In a different category, these gold medals are given during the time of the conference. We have a very important awards, which are this thing. The highest is a Dr. B. Mukhopadhaya Lifetime Achievement Award, which is the highest award which is given to a very senior and eminent orthopedic surgeon every year. And I'm happy to say this award was instituted when I was the president in Jaipur in year 2000. And I'm very happy to put it on record that the first B. Mukhopadhaya Lifetime Achievement Award went to Professor B. Mukhopadhaya. I said, there's no other person who deserves so much. Because of Dr. Mukhopadhaya, the Indian Orthopaedic Association came into the existence. The second highest award is the Honorary Fellowship of the Indian Orthopaedic Association. It is again given to a very senior orthopedic surgeon for his very his big contribution to the field of orthopedics in the country. And then is the B.N. Sinha Meritorious Award. These are the three very important awards of the association. With the grace of God, I have already received B.N. Sinha Meritorious Award and the Honorary Fellowship of Indian Orthopaedic Association, all because of the blessings and good wishes of my friends and my teachers. There are lots of oration which are going on. Kinney Memorial Oration, as you know, is given by the immediate past president. Diamond Jubilee Oration, Golden Jubilee Oration, Silver Jubilee Oration, Shekhar Ghosh Oration. Sebal Shekhar is the son of Dr. M.S. Ghosh, who was an orthopedic surgeon in England and who had a malignancy and died. And in his memory, we're having this thing, Balu Shankar narration. You all know the contribution of Dr. Balu Shankar. We have to honor some of the very stalwarts and the pillars of the orthopedics in this country. We are having a eponymous lecture, Dr. A.K. Talwalkar eponymous lecture, B. Mukhopadhaya eponymous lecture. I gave this lecture in the eponymous lecture, Dr. B. Mukhopadhaya, in 2014 conference at Agra. Dr. K.S. Girewal, Dr. P.K. Durai Swami, A.K. Shah, and M. Natarajan. We are publishing the Indian Journal of Orthopaedics, Proceedings of the CME, and newsletter of Indian Orthopaedic Association. From 1955, we have these are the stalwarts who have remained the president, and you can see that the present president is Dr. Ramesh Sen from the PGI Chandigarh. The landmark presidents have been, our first president was Dr. B.N. Sinha, and our 10th year president was Dr. B. Mukhopadhaya, and our 25th year president was Dr. N.D. Agarwal, and 50th year president was Dr. K.H. Sancheti. These are the landmark presidents. And similarly, we have the secretary. The first secretary was Dr. B. Mukhopadhaya. 10th year secretary was Dr. A.K. Gupta. 25th year secretary was Dr. Rama Rao. And in the millennium year and in 50th year, Dr. Raza was the secretary of the Indian Orthopaedic Association. And these are the different secretaries from 1955 onward. You can see this. So in 1955, when we started our association, we had about 15 members. And in 2021, we have 14,000 plus members. So our body is now a very strong body. So we hold a lot of good work, and our journal is now index journal and has been rated in the orthopedic world as one of the finest journals. Now, this is the 1958, when the annual conference of Association of Surgeons of India, 1958, Visakhapatnam, and these are the all stalwarts orthopedic surgeons who are there in Visakhapatnam. You can see that it's a very landmark photograph. I somehow got some from somewhere, and I tried to put it up here. And now you'll be happy to know that we have a beautiful Indian orthopedic house near Batra Hospital in Delhi. We have got a boardroom, we have got a office, we have got bedrooms, we have got so it's those who want to go and stay there, they can always write to our executive secretary Pandey and book a room and can go and stay there. And this, the IOA house, the credit goes to one of the past president, Dr. S.S. Yadav, who played a very crucial role in getting this thing formed. So this is how the Indian Orthopaedic Association has evolved from 1955 to 2021, and we are going stronger and stronger every day. And we have now a collaboration with many of the association abroad, and we are partnering with them in the different research projects, exchange program, etc. Thank you so much, John, for your time, and Janki for your time. Thank you so much.
Thank you very much, Dr. Taneja. I think that's a mine of information that I think it's very useful to know, and especially the younger orthopedic surgeons really need to know about the history of both orthopedics and the Indian orthopedics in India, as well as the Indian Orthopaedic Association. So I think we will all remember a lot of things from this talk, and hopefully can pass it on to our successive generations. So if you have any questions, otherwise.
So can you please, I think stops here, sir, then.
It's okay.
Okay, sir.
Thank you.
Thank you so much. Yes, sir. So just one thing, sir, that you have mentioned about contribution of the Indian orthopedicians, the ligands of Indian orthopedics. So you have mentioned so many names. What is the most important thing. If you can elaborate for few of them, sir, like about the Mukhopadhaya sir and Joshi sir. If just one or two words for them, if you can elaborate what you can remember, the most important thing, which postgraduate should remember and can be asked during the exam.
Okay, for the postgraduate students, because I have been an examiner for almost 30, 40 years, you see the few things we ask the postgraduates. The one thing we usually ask that, can you name few eminent orthopedic surgeons who has been responsible for bringing this orthopedics to this level? So usually the students are absolutely dumb and quiet. And I would tell the student that they must know the name of Dr. B.N. Sinha, Dr. Mukhopadhaya from Patna, Dr. Karam Singh Grewal, Dr. P.K. Durrai Swami, Dr. Talwarkar, Dr. Lakia. These are and Dr. Gopalakini and Katra. These 6, 7 names they must know because they were the main pillar and the thinker and the backbone of the developing the orthopedics in this country. That is one thing they must know. The other thing they sometimes we ask the students that can you tell me the very high honor academically which our orthopedic surgeon have received? The answer is yes. Our 2 orthopedic surgeons were invited to give the Hunterian lecture by the Royal College of Surgeons. The first was Dr. B. Mukhopadhaya and the second was Dr. Sharan of Coimbatore. This is another very important thing that our boys should remember that. And then the third thing that sometimes we ask the postgraduate student, can you tell us there's some very important contribution academically by our Indian orthopedic surgeon? Yes, the answer is especially in the field of tuberculosis by Dr. Tuli and Dr. Anil Jain, and in spine, the work of Dr. Rajshekharan, and in the terms of paraplegia by Dr. Sharmukh Sundram, and his work on the giant cell tumor. These are the few important landmarks, the research work that has been recognized, and work of Dr. Durrai Swami on clubfoot has been recognized abroad. This thing. Dr. Mini Mehta's work, of course, on infantile scoliosis was done in London, but she was an Indian orthopedic surgeon, and I think it is worth mentioning her work on scoliosis, which won her the Robert Jones Gold Medal. So these are the few things that our postgraduate must know if they not do this thing. That is, and of course, on international level, they must know the name of Ewan Thomas, the Lucas Champagner. These are the few people, Ambrose Parley, Percival Pott. They should know it about it.
I think another couple of things which I think is very important is Dr. B.B. Joshi for his
handwork.
Handwork. And of course, Dr. P.K. Sethi for the Jaipur
P.K.
foot.
Sethi, Jaipur foot, yes. They must know that.
I think these are
B.B.
very
Joshi and
important
P.K.
contributions.
Sethi. Exactly. Very important contribution, internationally acclaimed. Yes.
Yeah. And Dr. P.K. Sethi also got the Magsaysay Award.
Magsaysay Award. Yes. The only orthopedic surgeon to have won the Magsaysay Award. Yes.
So I think, thank you very much, Dr.
Thank you, John. Thank you,
I think it's
Janki.
almost 8 o'clock, so we will call it a day and meet again next week. Okay.
Thank you so much, sir.
Good night.
Bye. Good night.
Thanks.
Thank you.